My name is Dr. Tiffany Chow. I'm a behavioral neurologist, and that's a subspecialty within neurology that concentrates on people who are developing cognitive impairment due to a dementia. And that has been my special focus over the course of my career. I have specialized in working with patients and families living with frontotemporal dementia. Currently, I'm working at Alector, and I am a vice president of clinical development. Most people are not expecting a person younger than 70 to have dementia, but frontotemporal dementia, or FTD, attacks the function of the frontal and the temporal lobes of the brain, and that can strike before age 60, starting in three different ways. And those three ways are behavioral change, or a major loss of movement, and language loss. Uncharacteristic decision making or behaviors in a 50-year-old may be misinterpreted by family or friends as a midlife crisis, but these may actually be initial signs of FTD that warrant medical attention. In my experience as a clinician, many family members have told me that they can remember the patient doing something or acting in a way that was unusual compared to their familiar personality and interests, but it didn't kick in that this was an illness until later. So examples could include somebody who's a do-it-yourself devotee who can no longer organize a trip to Home Depot to pick up the right parts for an easy home repair, or he can't complete the task without multiple helping prompts. Or a soccer mom who doesn't show up for practice or retrieve the kids after a game and doesn't seem to care. These are symptoms for the most commonly occurring type of FTD called the behavioral variant. The frontal and temporal lobes of the brain also manage one's ability to move and to communicate. When a patient's FTD causes mostly muscle weakness or the loss of smooth and coordinated motion, the diagnoses may be amyotrophic lateral sclerosis, ALS, or corticobasal syndrome. When a patient loses mainly language ability first, the FTD diagnosis may be primary progressive aphasia. So although FTD typically starts with behavioral, motor, or language symptoms, by the end of the full illness, the patient will develop impairments in all three of these areas. FTD is a rare cause of dementia, which is different and less common than Alzheimer's disease. However, it's one of the most common causes of dementia that starts earlier in life than age 60. So those who would like to know more about symptoms of FTD can find more information at learnftd.com. And there's a guide to download for discussing FTD with healthcare providers. In case the person's doctor is not yet familiar with FTD, medical centers which specialize in FTD can be found at the NIH, or National Institutes of Health, website. FTD researchers have been describing abnormal protein accumulations found in patient brains. They're mostly different from those found in Alzheimer's disease or Parkinson's disease. What makes a brain produce these abnormal versions of the proteins at midlife remains to be discovered, but there's a clue in that there are multiple inherited or genetic forms of FTD. This means they're caused by gene mutations or changes in the DNA code. Three gene mutations that may lead to FTD are granulin, C9orf72, which is also closely associated to ALS. Some people call it Lou Gehrig's disease. And the third one is MAPT, M-A-P-T. If people have questions about genetic FTD, we recommend they speak with a doctor or a genetic counselor to learn more about the genetics of FTD and considerations to make when considering or thinking about genetic testing. Currently, doctors may prescribe medications that address symptoms associated with FTD, such as anxiety, obsessive compulsive behaviors, or agitation. But none of these therapies were specifically approved for use in FTD. Family needs help managing financial, career, and patient care decisions. Patients with the cognitive, behavioral, or communication problems caused by FTD may need to retire or seek long-term disability. Again, they're young. Alector recently conducted a survey of 90 primary caregivers of individuals with FTD. Some of the findings really define current challenges. Over 33% of caregivers reported that they spent more than 40 hours per week providing direct care. 28% resigned from their job to provide this care. 30% retired early. 47% had to decrease their working hours. When asked about their own personal health, approximately 60% of caregivers expressed that it was either somewhat difficult or very difficult to see their own primary health care provider or specialist. The most needed caregiver support services and information were also generally the most difficult for FTD caregivers to access. Top barriers to finding and accessing services or just information for caregivers included affordability. For example, respite, in-home care, or adult daycare are costly. And they also suffered time constraints for participating in caregiver support programs. Also, keep in mind, patients may be ineligible for coverage of some resources because they're still under the age of 65. A variety of clinical research studies are underway. There are studies to learn about the natural progression of the disease's impact on patient and caregiver quality of life, or trials to evaluate experimental treatments. There is no current FDA-approved treatment for FTD. Patients and families can learn more about these studies at ftdregistry.org and the AFTD, all one word, .org, which is the website for the Association for Frontotemporal Degeneration.